Prepping the house before surgery. So I always recommend to patients that they do get really organized beforehand. Now, for most of them, it's quite interesting because I often say to them, when I speak to them a couple of weeks beforehand, it can feel a bit like nesting. So, anyone that's had children, before you have a baby, you go through this crazy nesting phase where you end up like painting walls, not just the baby's room walls, like everything. You think you're going off to war and you're never going to come back, or you're going to never be able to do anything again. So, you end up like whizzing around the house, organizing stuff. And lots of patients do actually go, yeah, that is how I feel. So it's actually quite a good time to get a few bits done that you haven't done previously. But prepping the house is really important. Batch cooking, get yourself making soups and some easy meals that you can freeze or have in the fridge. Get that big food shop delivery done so you've got everything for 2 to 4 weeks. You're stocked up. Get all your washing done, make sure you've got clean bedding on, clean towels, make yourself a little nest in the bed is what I like to say, recovery nest. So yeah, you do lots of things beforehand to make your first 1 to 2 weeks afterwards a lot easier for yourself. I usually suggest to patients that are having anything with their breast or their arms or their abdomen, move those cups and plates down from high cupboards, or any of your personal items that you might need. And the other thing I say is write yourself a list for usually about week 2, when things, you're feeling a bit better, you're over that first week of survival. And then in week 2, your mind can get bored. So that list needs to have on it like stuff that's really boring that you never get around to doing in normal life, but that isn't high intensity. So things like sorting out your sock drawer is one of my favorite ones to advise people to do. Just something that's low intensity and that just stimulates you and make you feel like you've achieved something. I'm all for achieving something small every day, and even in recovery that can be really helpful. So you want to be writing lists of some little admin bits or some sock drawer sorting. I don't want you painting walls afterwards or, doing the gardening, but do those little jobs. And also get yourself podcasts downloaded, books or films, save films for when you are in recovery so that you've got a plan, have a recovery plan that can really help patients before and after their surgery.